My name is Dr. Ahmed Abdullah, and I'm a plastic surgeon. Have been for about a little over 20 years in the U.S. And I've been coming to Dubai now for about a year, and finally decided that maybe I'll do some work here. So here I am at Dubai Cosmetic Surgery. Well, plastic surgery kind of comes in two forms, if you may. One's called cosmetic surgery, which everybody's familiar with, and one's called reconstructive. And cosmetic surgery is done for elective reasons. Somebody doesn't like the way something looks and they want to change it, just like getting nice clothes or buying nice jewelry, or it's for self-esteem, looking better for yourself and all of that. So that's the cosmetic part. Reconstructive is non-elective, obviously, because there's been a deformity caused by either a birth deformity or accident or illness, or some reason external to the person's likes or dislikes that causes an issue with a part of the body that causes a functional problem. Okay, so to reconstruct that is also a realm of plastic surgery, and so it's non-elective surgery in the sense that if you don't fix that quote-unquote deformity, then there's a functional impairment. So that's the difference. Well, it's as a plastic surgeon, our training is to make things whole, make things look better, and all of that. Now, at a certain point, surgery is, and surgery, when I say surgery, I just don't mean cutting with a knife. I mean even injecting things. At some point, surgery is trauma, and trauma causes deformity. Okay, and so that's important to keep in mind, that you can only try to improve something so much, and then you're actually causing an unimprovement, or it's going the other way, and you got to draw the line there. I tell my patients the enemy of good is better. Okay, so if something is already good and you try to make it better, you could actually make it worse because you're causing trauma. And people don't realize it. They think cosmetic surgery is like going and getting your hair done. Well, it's not. It's causing it's a one-way street. It's causing an irreversible change that if carried on too far, may be a change for the worse. But like I said, you can't go back. So as plastic surgeons, we really have to keep that in mind when we're consulting with people. When somebody comes in who's had 18 different procedures done, and they want to just improve something a little bit more, then you got to say, okay, you shouldn't, or and these are the reasons you shouldn't. In cosmetic surgery, if we can make something better, we'll do it. If we can do something that'll keep it the same or make it worse, obviously we don't want to do it. Rejuvenation is reversing the natural process of aging. Okay, so our tissues, let's talk about the face. Our tissues over time will, succumb to aging, and we're, upright animals, and so it's not just aging; it's also gravity. So between those two elements that are natural, the progress happens such that tissues sag, and you lose volume, you lose, skin quality and tone, and all of those things. And so try to rejuvenate. Rejuvenation means to bring that back to as close to an earlier stage in aging than it is now. So you try to make a 60-year-old look like a 40-year-old. Yeah. Can you take a 60-year-old and rejuvenate them all the way to a 15-year-old? Probably never. But the whole idea is to make things look fresher and more naturally younger. Three things happen basically over time. One is the surface changes in the face, so you get age spots or fine wrinkles, and those things start developing. That's the surface anatomy that starts changing. The second thing that happens is, like I said, gravity kind of takes an effect, and things tend to loosen up and sag, going south. And the third thing that happens as we age is we lose volume in our face, and that starts actually pretty early in life, even in the 20s. So we start losing some volume in our face, so the eyes start looking a little hollower, the creases around the mouth and all get a little deeper, the temples get a little deeper. So that volume loss. So the first thing that happens is, number one, the skin changes. Okay, so who comes in complaining of that? Even 20-year-olds. Now, of course, we can contribute to those changes in a faster way. Certainly, the ones on the surface, and that is go out there and bake in the sun. Put baby oil on the face and fry in the sun. Depends on the kind of cooking you like. So that's we contribute to that, and so those changes can start actually fairly early. And the most common story is somebody comes in who's like 28 and says, "Oh my gosh, I woke up this morning and there was a little wrinkle here. I've never had it before." Chances are it's been slowly developing; they just noticed it. But that's probably a very common thing. And that's where the modalities such as Botox and fillers and things like that come in, where little changes can be changed by either injecting something that stops the wrinkle from forming, like muscle contracture, or fills an area that you've lost a little volume, or things like laser and peels and things which will actually rejuvenate the dermis and increase your elasticity of the skin and tighten it up enough that little tiny wrinkle disappears. So those are minimal processes that you can do for early complaints. And the second thing is actually volume loss. Volume loss actually starts fairly early. Like I said, sometimes in the 20s, it depends on your genetics. And then that, where the fillers and things like that come in, where we go in and inject a little Restylane or Juvederm or Radius or whatever, and try to fix that. Usually in the 30s, or that kind of starts. And certainly by the time we hit our 40s, like I said, the 40 the warranty gives up, and after that you start seeing all the issues, and the sagging and things like that start that. And then you need to look at modalities such as deeper surgical modalities to fix that. Problem is sometimes people come in late with say, well, I don't want any surgery, but and the tissues are hanging down to their neck, and they say, can we just put a few fillers and as surgeons, as physicians, we need to do the right thing for the patient. And I turn away a lot of people who come in with that kind of and say, hey, just put a little. I say, you're wasting your money with Botox. You're wasting money with fillers. You need this modality. You need a short scar, facial elevation, mid-facelift, eyes, whatever. And if I just put a little filler, that's not going to lift anything. That's going to give you some volume back, but your tissues are hitting your shoulders, and we need to bring them up. I don't say that, but that's the point. So that's so you usually have to use the right modality for that. And or somebody comes in their 20s and says, I need a facelift, and they don't. And so then I have to tell them, you don't need that. Maybe a little filler or a little Botox may buy you some time as far as your own psychological perception is concerned. So you've got to do the right thing. So facial rejuvenation is now the key. You rejuvenate the face using the appropriate modalities, not just one size fits all. First of all, it's worldwide. I've practiced in the U.S. for 20 years, and trust me, a lot of people don't understand the importance of sunblock there. It's very simple. It's basically it's UV radiation. UV radiation comes from the sun, comes through our atmosphere. It's filtered to some extent at the ozone layer, but UVA and UVB rays get through. They get through and they penetrate our skin, and they are ionizing radiation, which means that they will take your cells and basically it's like hitting them with a laser beam. Okay, and when you do that, the DNA kind of gets damaged, and the DNA is the template from which you make new cells to make new skin. The importance of protecting your skin starts early, when you have the least understanding of this, because you don't want to, and you're 15, 16, 18, 21, and you're invincible, right? Well, you're not. And the arguments are, well, I can't not go out in the sun, I won't make vitamin D, and you don't need a whole lot of sun to make vitamin D. Yeah. I can walk from here to my car and I'll make plenty of vitamin D for the day. So I don't have, if I go bake in the sun, I can't justify that by saying I'm making vitamin D for myself. I'm basically destroying my DNA templates for my proteins. So sunblock really, really early. And people say, well, I use 100, I use 50, and all of this doesn't make a lot of sense, because at 15, SPF 15, you're getting 92% of protection. SPF 30 gives you 4% more. SPF 60 gives you 0.1% more. So, it's a myth, it's a misperception that the higher number is good. You should have good chemical blocks in it, you should have zinc and, all those things. It's called simple skincare, beautiful skin, because we've forgotten simple skincare. All we do is complicated skincare, and so, because it's a competition, there's thousands of companies out there, so of course I'm going to make my product better. I'm going to make it more sophisticated, more fancy sounding. I'm going to make it like, it's got all the technology of a space rocket in it. The reality is, skincare doesn't need technology for space rocket. It needs a simple, logical, use of products that's easy, so that you get results.